things I wanted to talk to you guys about today is the distribution of the second quarter of the vaccine from Ottawa. We have some serious, problems with how they went about doing this and how much Manitoba is going to be getting as a result of that. They originally gave us sort of 4 options, which was one was on a per capita basis. The second was based on the number of Indigenous people that you have in your province. Third was based on the number of elderly people, and the fourth was a combination of Indigenous as well as elderly. And so we had expressed that we felt it would certainly be better for Manitobans. Our priority so far has been on Indigenous people and elderly people when we're rolling out the vaccine, and so we said option 4 would be best for Manitobans. Unfortunately, yesterday they called a meeting of deputy ministers, and we were told what was going to happen, and it's going to be on a per capita basis. So we really didn't have an opportunity to have a say on that. So we have indicated to the federal government that this is very serious. This has serious implications for Manitobans. It's way less in terms of the dosages that we'll get for Manitobans, and so we have been in contact with Ottawa to let them know that. So I just wanted to let you guys know that today, and certainly we can get you the specific numbers involved and that sort of thing if there's an interest there.
When you say it's way less, how many?
Pardon me?
This is the AstraZeneca vaccine?
Yeah, this is, the...
And so you're not referring to the Moderna or the Pfizer vaccine when you talk about...
No, sorry, this is not the AstraZeneca. This is the Moderna and the Pfizer. This is the second quarter distribution for the Moderna and the Pfizer.
So
Sorry
what you
about
just
that.
said doesn't apply to AstraZeneca?
It's not, no, it's not
It applies
AstraZeneca.
solely to
That's separate. This is only Moderna and Pfizer for the
So you're
second
saying,
quarter.
Manitoba should be getting more than its per capita?
We should be getting it based on what the priorities. So NACI has set the priorities, populations, as to who should be getting the vaccine. So, First Nations, obviously, and elderly, both. So we have prioritized both of those in Manitoba. If we did it on that basis for Manitobans, we would get more vaccine because we have disproportionately more Indigenous people in Manitoba than other provinces. So that's why it would be better for Manitobans. Obviously, we would get more doses of the vaccine. So obviously, this is, it's going to be very upsetting, I would think, to First Nation communities as well as the elderly who will be impacted as a result of us getting less of the vaccine.
So far you have been getting more than your per capita share. The numbers show that. And what you're saying is that Ottawa is now saying they're going to even that out, so Manitoba is going to get...
Yeah, so it will all be done on a per capita basis. I should say that those in the territories are getting more. They're getting it based on the vulnerable populations, and we're just asking that we're able to do the same.
And by second quarter, just to be certain, you're talking April to
April
June?
1, that's right.
From April.
Right.
And are you able to furnish us with numbers about what you think you should be getting as opposed
Yes.
to what you are?
Yeah, we'll get you the details on that, sure.
When do you think you're going to receive AstraZeneca?
So, we're hearing that it's sometime within the next couple of weeks.
Mid-March.
But yeah, it's mid-March, mid to late March. But again, it's, we sort of may find out the day before and then it arrives the next day. Having said that, that's been happening all the way along, and we've been ready with our vaccination task force in terms of the distribution model that we've set up, and we're ready to go. As soon as we get those vaccines from Ottawa, we'll be ready to go.
And has